Evergreen Certifications. Today, I have the honor of having three of our advisory board members for our newest certification, Certified Women's Health Specialist. Cindi, would you like to start off doing introductions?
Sure. So I am Cindi Lockhart. I am a registered dietitian. I'm trained in integrative and functional nutrition and medicine. So I came upon this. I mean, this is why I'm here and so passionate about what we're doing is my own health was failing when I was in my 30s. And so I found that conventional medicine didn't work, and that's how I found functional medicine. So with functional nutrition, we're really focused on getting to the root causes and helping people optimize their health holistically through nutrition and lifestyle measures.
Great. Aimee, would you like to go next?
Yes, I'm Aimee Bailey. I'm a physical therapist in Nashville, Tennessee, and I have been working in pelvic health and women's health since 2006. And I own a holistic practice where I incorporate yoga, Pilates, and health coaching just to help break down all the taboos that are associated around women's health and just provide more education and support for women.
Excellent. And Betsy, if you want to finish us off with introductions.
Sure. My name is Betsy Shandalov, and I'm in the San Francisco Bay Area, and I'm an occupational therapist. I've been an OT for 30 years, but 15 of those I've done integrated medicine. So I started my own private practice doing yoga therapy, as well as Reiki, meditation, mindfulness. And then recently, I also got my certification as an Ayurvedic wellness coach. And just in July, I have become a death doula. So it's really interesting to start to think about putting all parts of women's health with all of us. So I'm excited to be here today.
Excellently. Certainly a very good range of knowledge on the screen with lots of different perspectives. And we're so honored to have all of you as advisors with us. So I guess let's just hop into some questions that I have to help our audience better understand the certification, as well as some knowledge they'll gain through obtaining this certification. So first question I have for you. Why should someone become certified and obtain additional knowledge in the topic of women's health? Cindi, do you want to kick us off with that question?
Yeah, I love this. So women's health, we're all women here. So we get it. We understand it. It's like our bodies and our hormone systems are constantly shifting, and they're a lot more complex than men's. I always loved the analogy of we're more like a circuit board than a light switch. We are complex, and we're actually more susceptible and vulnerable to the effects of stress on our health and our function. And stress is everything, in the environment, and also emotional. And that increases our risk for a lot of chronic diseases. So, I mean, we're like, 2 times more likely to have anxiety or Alzheimer's. We're 85% of autoimmunity is in women. We're 8 times more likely to get low thyroid function. So, I mean, we are a lot more vulnerable, but we're being overlooked, and we're also being dismissed. So a lot of women are being told, it's just in your head, you're fine, go on home and you can figure this out. But we can't. We need to have more practitioners educated, know what to look for, know what to listen for, and know what to do to help women, empower women to know that there is hope. You can feel better. You can get back to your life. So that's what I would say, why it's so important.
Well, and if it's okay for me to add, I love everything that Cindi just said, and also I'm finding that as I age as a woman, and I'm an occupational therapist, not only with the women's health certification am I helping my clients that are women, but also myself. And in turn, that self-care is very important for compassion fatigue and for a lot of things that we as therapists and in people in healthcare really find every day. And so I think the certification can really help with that.
Oh, absolutely. Absolutely. So I guess moving on to our next question here. This certification, the information and the knowledge that people will gain is in many areas. So healthy aging, hormone imbalance, pelvic health, pregnancy and postpartum, common conditions, and then that socio-cultural well-being piece as well. So it's I would say unique, and it's a very much all-encompassing, well, I shouldn't say all-encompassing, but very much a broad, gives people a lot of knowledge. So kind of what other things of knowledge that maybe might be unique or not talked about as much? Do you feel, Aimee, that maybe people will gain by getting knowledge in this certification?
Yeah, I think just the multidisciplinary nature of this certification is huge. Just bringing in different backgrounds to help propel and getting that full range of education to women. There's so much that we're learning now that has been missed in the past, and we were thought of as just small men. And now we're realizing the socioeconomic piece to it. We have working women, we have women who are mothers and working, and then we throw on top of that hormonal changes through the lifespan and how that can affect women and healthy aging. So I think this is so unique to get the whole collaborative piece, but also the pieces that affect women specifically through the lifespan. So there's so many taboo areas. I keep bringing that up because it's so important that women often don't understand what their vulva looks like or their pelvic floor. And so breaking down some of those barriers so we can freely talk about our anatomy and talk about the function as we age and how that impacts us in our day-to-day life.
Absolutely, yes. So, Betsy, what professions, will this certification benefit? What areas, professional people, do you feel really will get the most benefit and knowledge out of this certification?
Well, certainly all women, because that's first and foremost, but also everything ranging from a physical therapist to a physical therapist assistant, an OT assistant, a chiropractor, registered nurse, nurse practitioner, physician's assistant, physician, naturopathic doctor, a registered dietitian, and a certified nutrition specialist. But I would probably even add psychologist in there. I mean, I think that there are a lot of people that probably are well past the list.
Mm-hmm. Absolutely. Yeah. And like you mentioned, not only helping their patients, but also potentially helping themselves too. So part of a certification and kind of where we think of certification being different, slightly different than a certificate, is certifications requiring that renewal piece. So this, as practitioners gain this certification, the initial certification is for 2 years. And then there's a renewal requirement where we require that they take continuing education to maintain their knowledge in this topic area. So Cindi, I'd love your input. Why do you think it's so important for professionals to not, just take the one course and be done, to continue to maintain knowledge in these areas?
I think the good news is all of us have to do that anyway for our profession.
Yep.
So it's expected. Like if we're going to get a specialty certification, we're going to have to stay up to date because science is constantly evolving. So what you're going to learn in this current certification is going to change. It's going to shift as we learn more.
Absolutely. Yep. So then I guess wrapping up my final thoughts, and I'll kind of do a round table for all of you to be able to answer this question. And Aimee, if we want to start with you, why are you so passionate about this topic area? Why do you feel more people should learn and gain information and potentially move on to gaining the certification in women's health?
As a woman myself, I'm also the mom of 3 daughters. I just see the impact that women's health has and how so many times I've gone to providers and they didn't have the answers for me. So I think it's really important for us to up our education and be able to communicate well with women, seen, and they can really get the answers that they need. It's really important. Healthcare is changing every day and we're learning more and more. But I think understanding, when I started in pelvic health in 2006, the only thing I thought I could treat was women who leaked urine. And now I'm finding out that I can treat women who are pregnant, postpartum, have pain with penetration, have all sorts of stress disorders and so many nutrition deficits. And there's so many things that I've learned over the years that can be of value to women. So that's why it's really passionate for me that I can get that information out to women so they feel seen and heard.
That's great. Betsy?
Well, I, like Aimee, have 3 daughters. And so I definitely feel that women are, now equal in everything. But also I just want to add that myself, I'll just want to say I'm 53 years old. And I have brain fog and I have perimenopause, and all those things are not really described well by my practitioners that I go visit. This certification will do that. And I think it's really interesting where we are, people that are passionate about women's health. And so we're going to keep evolving. Also, just like Cindi said, all this is going to continue to change. And so in the certification, you can revisit it after 2 years and you'll find new information.
Yes, very much so. And Cindi, we'll let you wrap up with your thoughts.
Absolutely. So unlike Aimee and Betsy, I'm in a house full of men, including our daughters. So I can't speak to that. But I've been in practice for over 30 years. And I would say by far the predominant clientele that's seeking me out are women. And so, I mean, being a woman, I can relate. And as Betsy mentioned, she's 53, I'm 57. And so I've been through all of these stages. Now I still have more to go, I believe, but I'm definitely in that last shift of I'm in menopause, deep into menopause, and still finding things. I'm like, I should have known that was menopausal, but I didn't. So it's being able to understand our bodies, listen to our bodies, and seek out the right professionals. And it takes a team. I mean, all of us have different disciplines, but it takes all of us together with our clients in the middle to really feel heard, as Aimee mentioned, and because we don't get heard in a lot of conventional practices, and to know that there is hope to help people. And so by us educating and empowering other practitioners, we've got more boots on the ground to help women and to be the listener, to be the guide, to be the navigator, to be the partner walking along that journey, letting them know they're not alone, and that we can help them and have the resources in areas that maybe we're not proficient in. So like, how do you build your team as well?
Awesome. Well, thank you guys. I want to thank you all for not only participating in this event and getting more information out here about this certification, but also for helping the development and giving us your expertise so we could get through this, the launch and out to the public. We hope you all have a good afternoon. Thank you.
Thank you.
Thank you.